I'd like to welcome everyone to the 7th annual celebration of research here at LSU Health Shreveport. I'm David Guzik, Chancellor of LSU Health Shreveport and Dean of the Medical School. And I just want to start out by reiterating something I've mentioned from the beginning, which is that we have three missions at our academic health center: patient care, education, and research. There are many community hospitals around the country that provide great patient care, and they do a little bit of education in terms of resident education sometimes. But the thing that distinguishes an academic health center and brings university stature is research. And so one of my main goals in coming here to LSU Health Shreveport was to try to amplify the work that had been done by many of you in building a great platform and great fundamental building blocks for building a research program. And I won't steal anybody's thunder in just summarizing by saying that we are very proud of all the work that all of you have done in advancing that goal.
I wanted to share with you the vision of President Tate of elevating LSU to become one of the top 50 research institutions in the country. This ambitious goal clearly aligns with the mission, the aim and high mission of Dr. Guzik. But the question is, what do we need to do to become among the top 50? According to the NSF criteria, institutions that spend more than $600 million a year on research and development will be among the top 50. So how is LSU doing? I can share with you that last fiscal year, LSU almost spent close to $500 million on research and development. We are seeing an increase across the campuses, but if we are focusing specifically on extramural funding, which is the most important parameter, we can see in the campuses such as Baton Rouge and New Orleans, about 3 to 4% increase. But if you come up north to LSU Health Shreveport, you will see an incredible 11% increase in extramural funding. This 11%, that's what we need to bring us to the top 50. What is the key initiative to bring us to the top 50? And you can guess that the number one is to hire new faculty, impactful, well-funded faculty. And once we hire them, we need to support them with new buildings and new research facilities. And that's exactly what we've been doing. Since stepping into this role as the Associate Dean for Basic and Translational Research, with amazing support from Dr. Guzik and working closely with the department chairs, we were able to recruit a total of 14 new faculty coming here to LSU Health Shreveport from some of the best universities across the nation. In this list, you will see two new department chairs, Dr. Lal and Dr. Zhao, the new chairs for cell biology and pharmacology. You will find here Dr. Zheng, who left the institution last year and discovered about all the amazing things that are happening, decided to come back as the vice chair of neurology. You will find here in this list 5 candidates with K99R00 grants. Just for reference, so far in this institution, in the history of the institution, we had only 5 of them, and we just doubled the numbers in 9 months. This group of investigators coming from, again, top universities in the nation are bringing a total of 19 major R1 and R00 grants to LSU Health Shreveport. We are talking about an additional $25 million, but beyond that, we're talking about shaping the future of research here at LSU Health Shreveport. Moreover, we established new policies where we can promote our excellent postdocs to become faculty. Now they can submit their own funding as well. So in total, if we combine the new faculty that we added, a total of 19 new faculty in 9 months. And this is reflected by the numbers. Here you can see the extramural funding to LSU Health Shreveport over the last decade. On average, we have a 14% increase in extramural funding. Now, we all know this is quite challenging time with NIH and federal funding. We are awaiting a few awards, non-competing renewals, transfers, but if all of those are coming on time, we should see in fiscal year 2025 a 37% increase in extra UR funding. Beyond that, we expanded our core facilities with the additional 4 new core services. We offered a record high number in intramural funding, more than $3 million, to support our pre-docs, our postdocs, and faculty. And with all this increase in research activity and faculty recruitment, we are facing a new challenge. We don't have any more space to grow. But we are very thankful for the vision and the guidance from Dr. Guzik, who identified just across the street the old Sears building. We are incredibly thankful for the support for LSU Health Foundation that were allowing us to continue growing with more than 160,000 square foot available for research. And here are some preliminary designs, how we believe this will gonna look. We are very hopeful that demolition will start in the coming weeks and hopefully occupancy by 2027.
So I'm going to give you a little update for clinical research. And most of you who do know me know that clinical research is one of my extreme passions. More than food and more than woodworking, clinical research is what is in my mind when I'm awake in the day and even when I'm sleeping. Because clinical research is that classic kind of last mile problem to solve. That is, how do we move the things that most of you do in your laboratories and discover to changing healthcare? And none of us would engage in research if everything was copacetic, right? If everything was great, we wouldn't need research. Research is an investment in the future. It's an investment in better health for all of us, and especially at our institutional level for the people of Northwest Louisiana and beyond. And that's why we engage in research, to change the status quo. When it comes to clinical trials, currently we have over 135 studies ongoing between the clinical research office in the Cancer Center as well as the clinical trials office, which handles all of the non-cancer clinical trials. These are mostly pharma-sponsored, but a significant number of federally sponsored, as well as investigator-initiated studies. And we have a constant flow of programs and projects that are in startup phase, in maturing, and then sunsetting in these protocols over time.
The first award, the Research Excellence Awards, and the first one is Excellence in Extramural Funding in 2025 goes to Dr. Matthew Wooler. Dr. Woolard is the O'Callaghan Family Endowed Professor of Microbiology and is now serving as the interim chair of the Department of Microbiology and Immunology. His research seeks to understand the mechanism of immune function that contributes to disease progression, specifically intracellular lipid metabolism and macrophage function. He received his second R1 2 years ago from the NHLBI and NIGMS. This is a $2.2 million four-year grant, focuses on the transcriptional regulation of lipin-1 in macrophage pro-resolving response. Dr. Wooler also leads the immunophenotyping core in the COBRE, Center for Applied Immunology and Pathological Processes, which is also funded by the NIGMS. Congratulations again, Dr. Wooler.
I'm extremely pleased to present the award for excellence in clinical and translational research to Dr. Connie Arnold. Connie is a professor of internal medicine and division chief for healthcare disparities. Connie has been a member of our faculty for more than 20 years and a collaborator, really the quintessential collaborator. She is an investigator of practicality who really impacts patients' lives in sometimes what seem very simple ways, but it helps the patients do better with their health care. Connie is absolutely, I would say, a goddess of health literacy. Can I say that word these days? Yes. Connie has been an excellent mentor for many junior faculty as well as trainees over the past 20 years, and there's no one more deserving of this award. So thank you, Connie.
I have the pleasure of introducing the awardee of our Career Service Award. This year's awardee listed on your program is Dr. Nick Detters, longtime chair of the Department of Pharmacology, Toxicology, and Neuroscience. He couldn't be with us here today because he had a previous commitment as a keynote speaker at a neuroscience symposium in Baton Rouge. So it turns out that last year, the awardee, Dr. Sushil Jain, also couldn't be here, but is here today. Over the course of his career, Dr. Jain served as the principal investigator on 16 grants funded by the NIH, the American Diabetes Association, and the American Heart Association. He also has led 6 clinical trials, 4 supported by the NIH and 2 supported by pharmaceutical companies. Dr. Jain was appointed as the endowed chair in diabetes in recognition of his exceptional contributions to the field. His achievements have been recognized with several prestigious honors, including the Outstanding Investigator Award from the American Society of Nutrition in 2013 and the Foundation Award from the Society of Pediatric Research. He has contributed his expertise to the editorial board of numerous journals, including Diabetes and Diabetes Care. He's also served as associate editor for the Journal of the American College of Nutrition since 2015. Dr. Jain has authored over 200 publications, which have collectively received more than 22,000 citations. This gives him an H-index of 76, the highest among LSU Health Shreveport faculty currently.
Very excited to introduce this year's Research Rising Star Award to Dr. Anna Dragoi. Dr. Dragoi is an assistant professor of molecular and cellular physiology, associate director of the Inlet in the Feist-Weiler Cancer Center. Her research focuses on cancer biology, specifically on cellular regulation of epithelia to mesenchymal transition, and also host pathogen interaction. Dr. Dragoi was awarded her first R01. Congratulations, first R01. Last year, from the NIAID, it's a 1.8 million 5 years grant, focuses on the mechanism of macrophage function in gonorrhea. Prior to receiving this R01 grant, Dr. Dragoi led a project funded by the COBRE. So it's an example of the success of the COBRE, the Center of Applied Immunology and Pathological Processes, led by Dr. Rochko. Please join me in congratulating Dr. Dragoi.
And I have the pleasure and the honor to present tonight's Excellence in Scholarly Activity Awards. So this year's award recognizes researchers who have recently had their work accepted in a publication that's a high-impact peer-reviewed journal that has an impact factor of about 15 or higher. So these are significant. These are well-respected in academia as well as highly selective. So being accepted into this is a testament to the importance of their work. It's an achievement to be recognized, and it reflects years of dedication, hard work, and collaboration with colleagues around the country that has resulted in their findings meeting the highest standards of rigor, originality, and significance in their field. So the first recipient is Dr. Stanimir Ivanov, Associate Professor for Microbiology and Immunology. The next recipient of the Excellence in Scholarly Activity Award is Dr. Rohit Jangra, Assistant Professor in Microbiology and Immunology. Our next recipient tonight is Dr. Chang-Wong Park, Associate Professor in Molecular and Cellular Physiology, for a publication in Nature Communications. Our next recipient is Dr. Art Yurdagal, Assistant Professor and Graduate Program Director of Molecular and Cellular Physiology. And finally, the last recipient, Dr. Oren Ram, who I must note for 2 manuscripts published in Cell Metabolism and Nature Metabolism. Congratulations to each of you, and thank you for your noble contributions here at LSU Health Shreveport and beyond. Please join me again in another round of applause for these individuals.